Megan Shellhorn is a wife, a mother of three, and a high school teacher in her hometown. Her breast cancer journey began at the age of 38, long before most women have mammograms, when doctors told her they were confident the lump that she found in her breast was nothing.
My daughter laid her head on me when I was putting her to bed, and I just put my hand there and I felt something, and immediately I knew that I needed to take action.
The next day, she went for a mammogram and an ultrasound. Everything looked fine, she was told. Come back in a year. Relieved and grateful, she went about her life. But 6 months later, the lump was bigger, and she had a gut feeling.
And now what do you do? What do you do when you've been told you're okay, but your body is still showing you that it's not?
She thought, was she overreacting? But a biopsy done to reassure her found what the other tests had not.
I was completely blindsided that a result popped up in my chart, and it was invasive ductal carcinoma.
At 39 years old, Megan had breast cancer, and it had spread to her lymph nodes. The diagnosis, late stage 2. She went through a year of treatment, chemotherapy, surgery, radiation, and immunotherapy.
I'm like, are my kids going to have a mom? Is my 3-year-old going to grow up with me here? And that's so scary to think about.
Brinley, Samantha, and Riley were only 3, 7, and 11 at the time. It was terrifying for Megan and her husband, but thankfully not something her children could fully comprehend.
When she had to shave her head, I was worried I was going to love her less because she wasn't going to have any hair.
I remember she thought it would grow back pink.
Yeah.
The vast majority of breast cancers occur in older women. However, a new study by the American Cancer Society found a troubling rise in cases among American women younger than 50.
We're not really sure why women are being diagnosed younger.
Dr. Ashley Simpson is a breast cancer surgeon at University Hospital St. John Medical Center. She says doctors often see benign lumps in women under 40 without a family history. In light of the new study, Dr. Simpson's advice is to be more vigilant.
I tell my patients, you're with your breasts every day. I'm only with them once a year. So if anyone's going to notice a difference, it would probably be you before me.
A lump, an inverted nipple, or change in the skin on your breast. Dr. Simpson says take action like Megan did.
A further delay in diagnosis could have potentially turned her from a patient who could be cured to a patient living with chronic metastatic disease.
By being her own best advocate, this young mom likely saved her own life.
No one knows your body the way you do, and you have to keep pushing for answers. I really feel deep down that if I didn't push, even if I had waited the year that they told me to wait, that I probably wouldn't be sitting here.
In Warren, Stacey Fry, Fox 8 News. Megan Shellhorn is a wife, a mother of three, and a high school teacher in her hometown. Her breast cancer journey began at the age of 35, long before most women have mammograms, when doctors told her they were confident the lump that she found in her breast was nothing.